Hello and good day, everyone. My presentation today is titled An Interactive Dashboard Design for Nurse Call System to Support Nursing Workflow and Alert Management. This work is presented at 5th International Virtual Conference on Social Sciences, Education and Innovation 2026. This study focuses on improving how nurse call alerts are managed in hospital wards by proposing an interactive dashboard design that better supports nursing workflows and decision making. The work is based on qualitative insights gathered from nurses working in private hospitals and translate real operational challenges into practical interface design solutions. In the following presentation, I will briefly introduce the research problem, describe the methodology used, present the main findings, and finally conclude with the contributions and future directions of the study. This work was conducted by myself, Nurhidayah Bahar, Tengku Nur Amelia Tengku Ramli, Fadila Atika Nur Rashid, and Rimaniza Zainal Abidin, all affiliated with Faculty of Information Science and Technology, University Kebangsaan Malaysia. This study is part of ongoing efforts to explore digital solutions that support healthcare operations through user-centered and requirement-driven system design. Nurse call systems are important tools that allow patients to request assistance from nurses in hospital wards. However, nurses today work in complex environments where they manage many patients and respond to frequent alerts, which increases workload and interruption. Many existing nurse call systems are still conventional and provide limited information, making it difficult to prioritize alerts. Therefore, there is a growing need for more intelligent nurse call systems that provide contextual information and better support nursing workflow and decision making. Many hospitals still use conventional nurse call system that only notify nurses when a patient calls without providing sufficient information to prioritize responses. This leads to alert overload, increased workload, and delay in responding, especially when nurses manage multiple patients at the same time. Task distribution is also often manual, which can result in duplicated efforts or delayed assistance. Although previous studies have examined nurse call system, fewer studies translate nurses' workflow challenges into practical interface design solution. Therefore, this study aims to identify challenges faced by the nurses and design an interactive dashboard to improve alert management and workflow coordination. This study guided by two research questions. First, what challenges do nurses encounter when using conventional nurse call system in their daily practice? Second, how can these challenges be addressed through the design of an interactive dashboard? To answer these questions, the study aims to identify key workflow and alert management challenges experienced by the nurses in private hospital settings and to propose core functional components for a dashboard design that supports communication, alert prioritization, task coordination, and access to essential patient information. This study employed a qualitative approach to understand challenges associated with conventional nurse call system in real clinical settings. Data were collected through in-depth, semi-structured interviews with 6 nurses working in private hospital across different ward environment. All participants had substantial experience using nurse call system in their daily work. Purposive sampling was used to ensure that participants had relevant experience in wards using conventional nurse call system. The interview data were analyzed using thematic analysis to identify recurring workflow and alert management challenges. These findings were then translated into design requirement for developing the proposed interactive dashboard. The first key challenge relates to technology and component limitation in conventional nurse call system. Most systems only generate alerts without providing sufficient contextual information or communication capabilities. Nurses are therefore required to physically attend patients to determine their needs. This results in unnecessary movement and delays in prioritizing urgent cases, particularly in busy wards. The issue becomes more critical in intensive care and isolation rooms, where nurses must wear full protective equipment simply to understand the reason for a call. The second challenge concerns task distribution and responsibility allocation after a nurse call is activated. Participants reported that their task assignment is largely manual, making it difficult to balance workload among nurses. As a result, situations often occur where more than one nurse responds to the same call because they are unaware that another nurse has already attended to it. At the same time, other patient calls may remain unattended. Nurses also highlighted heavy workloads, sometimes managing several patients simultaneously, which forces them to verbally request assistance from colleagues. This finding shows that the need for system support that provides clearer task ownership and real-time status updates to improve coordination and ensure calls are handled efficiently. The third challenge relates to the lack of accessible patient information when a nurse call is activated. Nurses normally reported that alerts provide no accompanying patient or clinical information, forcing them to rely solely on the alert signal without knowing the urgency or nature of the request. Although patient information exists in electronic medical records, nurses often do not have time to access this system before attending the patient, especially when multiple calls occur simultaneously. Participants emphasize that basic information such as patient identity, room location, and risk or care status should be available at the point of alert to help nurses prioritize and respond more effectively. The fourth challenge concerns the absence of differentiated call categories, which contributes to alert overload and difficulties in prioritizing responses. Participants reported that conventional nurse call system treat all calls the same, regardless of whether the request is urgent or routine. As a result, nurses cannot determine the urgency of a call at the point of alert, especially when multiple calls occur at the same time. This forces nurses to attend each patient physically to assess urgency, increasing response time and cognitive burden as well, and ultimately reduce the efficiency of alert management in busy wards. Based on the challenges identified in conventional nurse call system, this study proposes an interactive dashboard comprising four core functional components. These components were designed to address the key limitations presented earlier. First, intercom communication and visual access. This component enables nurses to communicate with patients through two-way audio immediately after a call is triggered. These allow nurses to understand patient needs without immediately going to the bedside. In addition, a visual feed can be activated with patient consent, to enable nurses to assess patient conditions remotely. Together, these features reduce unnecessary bedside visits, support faster prioritization, and help nurses manage multiple calls more effectively, especially in high dependency or isolation environments. Second, nurse call visualization and status management. These components improve alert visibility by displaying nurse calls visually along with patient location and call status. Nurses can monitor multiple calls in real time and update call status once a call has been addressed. These reduce confusion about which calls are still pending and helps to prevent duplicated responses. Finally, to improve coordination during high workload periods. Third, assistant request and task coordination. This component allows nurses to request assistance directly through the dashboard when additional support is needed. It helps distribute workload more effectively and reduces the need for verbal coordination across the ward. As a result, task allocation becomes clearer and response efficiency improve, especially during busy periods when nurses manage multiple patients simultaneously. Lastly, patient information display for decision support. This component displays essential patient information together with the nurse call alert, including patient identity, location, and brief clinical details. By providing this information directly on the dashboard, nurses can quickly understand patient needs without accessing separate systems. These, we think, support faster prioritization, reduces cognitive load, and helps nurses make informed decisions when managing multiple calls. To illustrate how the proposed core functional components are integrated in practice, this figure presents the interface design of the interactive dashboard. The dashboard shows how multiple nurse calls can be monitored and managed simultaneously, with each call displayed using color-coded indicators to represent urgency levels, where red indicates the highest priority. Time indicators are also shown to help nurses monitor how long each call has been active, supporting timely responses. The interface also displays essential patient information alongside each alert, allowing nurses to quickly understand the patient context. Functional controls for intercom communication, visual access, assistance requests, and call cancellation are readily accessible. These would enable nurses to interact with the system directly from the dashboard. Additional patient or call information can be accessed when needed without leaving the main interface view. So, to further illustrate how the communication components operate during active nurse-patient interaction, this figure presents the interface view when the audio and video functions are activated following a nurse call. The dashboard displays a real-time visual feed of the patient together with an audio communication indicator, allowing nurses to communicate directly with the patient while remotely assessing the situation. At the same time, detailed patient information such as identity, age, gender, allergy information, diagnosis, treatment plan, and assigned doctor is displayed within the same interface. These enable nurses to quickly understand the patient's condition without accessing separate systems. Controls for speaking, activating the camera, requesting assistance, and cancelling the call remain accessible, allowing nurse to manage communication and coordination efficiently during the interaction. To summarize the results, this slide illustrates how the challenges identified in conventional nurse call system were systematically translated into core functional components within the proposed dashboard design. Technology and component limitations that previously restricted communication and contextual understanding are addressed through intercom communication and real-time visual access, enabling nurses to assess patient needs without unnecessary bedside visit. Challenges related to manual task distribution and unclear responsibility allocation are addressed through assistant requests and task coordination functions, allowing nurses to share workload more transparently. The lack of accessible patient information at the point of alert is resolved through integrated patient information display, enabling faster prioritization and informed decision making. Alert overload caused by non-differentiated calls is mitigated through visualization and status management features that provide color-coded alerts and time indicators to support prioritization. Finally, duplicated responses and unclear call resolution status are addressed through call cancellation, status updates, ensuring clearer coordination and efficient alert handling among nursing staff. In conclusion, the study examined challenges associated with conventional nurse call system in private hospitals and proposed an interactive dashboard design to improve alert management and nursing workflow. Qualitative findings revealed issues related to communication limitation, lack of contextual information, manual task allocation, and alert overload, which inform the development of integrated dashboard components. This study contributes theoretically by translating nurses' workflow challenges into concrete design requirements, while practically providing guidance for improving alert coordination in hospital settings. However, the study is limited to qualitative findings without full system deployment. Future work will involve prototype implementation, usability testing, and validation across broader healthcare environments. Thank you for your attention, and I hope this presentation has provided useful insights into improving nurse call systems through dashboard design.